Hi there, my name is Lori Chern from RN Collaborate. Today is November 12th, 2023. The RNC Restorative Health Program is developed to help you understand how to maximize your own unique and optimal level of health. This is the third of a 7-part series on restorative health. It'll focus on hormone replacement therapy and testosterone replacement therapy for women. This entire presentation is based on numerous studies and evidence-based practice with a list of approximately 50 references at the end of this presentation. This slide is a graph that illustrates the rise and the fall of the two most abundant hormones in women, which are testosterone and estrogen. The bottom of the graph depicts age. Testosterone is the pink line and, as we see, is the most abundant biologically active hormone in women. It peaks in our 20s and declines to half this level when we are 50. Estrogen is depicted in blue, and our levels of estrogen peak in our 20s also and plummets to nearly non-existence at menopause. Estrogen and testosterone are both hormones that our bodies naturally produce. Hormones are chemicals that are secreted from certain parts of our bodies that act on other parts of our bodies. Hormones travel through our bloodstream, then attach to cell receptors, and then instruct the cell to perform a certain function within that tissue or organ. It is not normal to function without these hormones. 100 years ago, and for thousands of years before that, humans typically did not survive past the age of 50, so extremely rare to live without estrogen and testosterone. Evolution has not kept up with our longer lifespan, as we now are living without estrogen and testosterone for decades after we turn 50, significantly contributing to chronic disease. We have estrogen and testosterone receptors in almost every cell in our body, which indicates that these two hormones have importance within almost every organ system in our bodies. As we age, diminished estrogen and testosterone levels result in decreased metabolism in our brain. Reduced circulation of estrogen and testosterone result in decreased exerting effects on many brain areas that result in brain fog, disrupted sleep, dysphoric moods such as anxiety, irritability, and depression, decreased libido, decreased cognition, which is thinking processes, and memory impairment. There are estrogen and testosterone receptors in our blood vessels. Estrogen exerts its effects by inhibiting the ability of inflammatory cells and macrophages sticking to the inside walls of our blood vessels. Also by decreasing LDL cholesterol accumulation at these sites. Estrogen also improves healing and new vessel formation. And it also induces nitric oxide production, which relaxes and dilates the blood vessels to maintain optimal blood pressure. All of which decrease atherosclerosis and improve cardiovascular health. Testosterone exerts its effect by acting like a blood pressure medication, such as a calcium channel blocker, to relax the smooth muscle of our blood vessels and thereby maintaining optimal blood pressure. There are estrogen receptors in all of our bones. Decreased circulation of estrogen results in rapid bone loss because estrogen is a key regulator of bone metabolism. When circulating estrogen decreases, estrogen receptors are not stimulated and bone resorption, which is breakdown, exceeds the rate of bone formation. This results in decreased bone density, which may eventually result in osteopenia and osteoporosis and increased fractures as a result of this fragility. The graph below illustrates how a decline in estrogen, which is the red line, is associated with decrease in collagen and elastin, which is the green line, and the results in a dramatic decline in skin health, which is depicted by the blue line. The skin photo above that graph depicts decreased collagen, elastin, and fibroblast formation in the dermis and the associated wrinkles in the epidermis as we age. Estrogen stimulates collagen, elastin, and erosin, which all contribute to skin integrity and elasticity that is associated with youthful skin. Estrogen increases hyaluronic acid, mucopolysaccharides, and sebum production, all of which contribute to skin hydration, skin turgor, preservation of dermal thickness, and keratinocyte and fibroblast production. Estrogen also improves blood flow and counteracts photoaging. Estrogen enhances facial attractiveness and perceived age in women. As women enter menopause, vaginal atrophy occurs. The symptoms of vaginal atrophy include thinning epithelial layers, dryness, decreased blood flow, decreased lubrication and increased dryness, unbalanced pH with disrupted microbiome, which means it has a decreased healthy bacteria that protect against invasive bacterial strains. Estrogen in the forms of topical creams and systemic hormone replacement therapy restores the epithelial layers. It improves blood flow, also replenishes lubrication and minimizes dryness. Estrogen restores healthy microbiome, which is our healthy bacteria, and maintains optimal pH balance. Because circulating estrogens facilitate healthy bacteria colonization and restores blood flow and tissue and lubrication in the vulval, vaginal, and perineum, women's risks of urinary tract infections decrease significantly. Pelvic floor tissue is also maintained, which remarkably reduces the likelihood of urinary incontinence. As we enter perimenopause, the decrease in circulating estrogen causes more fat distribution around the belly that eventually leads to visceral fat, which is fat that infiltrates our organs, and also fat infiltrating our muscle, which significantly reduce the efficiency of both our organs and muscle, leading to insulin resistance, poor metabolic health, obesity, and increased risk of cardiovascular disease. Testosterone therapy increases muscle mass by increasing muscle protein synthesis. Testosterone at therapeutic levels does not masculinize women, but rather stimulates femininity. Estrogen therapy supports maintenance of muscle mass, facilitates muscle regeneration, and decreases abdominal fat deposition. Both testosterone and estrogen will increase functional metabolism, improve insulin resistance, and help decrease the risk of metabolic disease, which include type 2 diabetes and obesity, and also decrease the risk of cardiovascular disease. Both estrogen and testosterone therapy protect our liver health and therefore our fat and cholesterol metabolism, which greatly protect us against metabolic syndrome. Again, includes obesity, type 2 diabetes, high blood pressure, and cardiovascular disease, which includes atherosclerosis, heart attacks, and strokes. Both testosterone and estrogen protect against inflammatory bone and joint inflammation, which include both rheumatoid and osteoarthritis, by preventing cartilage degradation and synovial inflammation. Both estrogen and testosterone have anti-inflammatory effects on our nerves and brain neurons, which protect against fibromyalgia, neuropathy, and chronic pain syndrome. Many research studies have also identified that estrogen and testosterone is protective against demyelination and may rehabilitate demyelination, which has significant positive implications for people with multiple sclerosis. Through multiple complex pathways, both estrogen and testosterone help regulate our immune response by modulating all levels of the innate and adaptive immune systems. Both estrogen and testosterone also have anti-inflammatory properties, which contribute to our immune health. As noted in one of the first slides in this presentation, there are many estrogen and testosterone receptors in our brain. Neuroinflammation, which is inflammation of our brain cells, is the major mechanism involved in the pathology of Alzheimer's disease. Estrogen and testosterone decrease inflammation in the brain by 1, decreasing pro-inflammatory cytokines, and by 2, increasing anti-inflammatory cytokines. Also, estrogen and testosterone increase nitric oxide synthase, which is an enzyme that increases cerebral blood flow and perfusion. Aging is characterized by systemic inflammation changes and organ dysfunction. Both estrogen and testosterone have anti-inflammatory properties. There are estrogen and testosterone receptors throughout almost every cell in every organ. Estrogen and testosterone attach to the cell receptors, then enter the cell and instruct the cell to perform a positive physiological function in order to maintain and improve the health and or function of that cell or organ, and therefore contributing to our health as a whole. Because estrogen and testosterone are both anti-inflammatory, chronic pain may be improved with hormone replacement therapy and or testosterone replacement therapy. Testosterone is anabolic, which means it builds us up. It builds our brains up, it builds our muscles up, it builds our stamina and energy up, it builds our libido and sexual desire up, it builds our sense of well-being up, and it builds our interest and pleasure of doing things up. Testosterone is a natural hormone in our body. At therapeutic replacement doses, it feminizes women. And as Louise Newson, a medical doctor in Europe, 2023 noted, testosterone lights up our brains. Hormone replacement therapy and testosterone replacement therapy decrease the risk of cardiovascular disease, cancer, bone fractures, type 2 diabetes, decreased visceral fat, metabolic dysfunction, which include diabetes and obesity, long COVID, sleep disturbances, neurodegenerative diseases such as Alzheimer's disease, dysphoric mood, including anxiety, irritability, and depression, vaginal symptoms such as dryness, atrophy, and pain during intercourse. Also decreases our risk of fatty liver disease and fat metabolism problems. Here is an academic article by Hoddes and Mack in 2022, analyzing many research studies. Title by the red star is Menopausal Hormone Replacement Therapy and Reduction of All-Cause Mortality and Cardiovascular Disease. It's about time and timing. Reading the abstract that is circled in green, totality of evidence indicates menopausal hormone replacement therapy effects are determined by timing of initiation according to age and or time since menopause, underlying health and target tissue and duration of therapy. Initiated in women less than 60 years of age and or at or near menopause, hormone replacement therapy significantly reduces all-cause mortality and cardiovascular disease. All-cause mortality just means that every single reason for death. Whereas primary cardiovascular prevention therapies such as lipid lowering fail to do so. Magnitude and type of hormone replacement therapy associated risks, including breast cancer, stroke, and venous thromboembolism, are very rare and not unique to hormone replacement therapy and comparable with other medications. Hormone replacement therapy is a sex-specific and time-dependent primary cardiovascular disease prevention therapy that concomitantly reduces all-cause mortality as well as other related diseases with an excellent risk profile. Keeping in mind that prevention strategies must be personalized, healthcare providers and patients can use cumulated hormone replacement therapy data in making clinical decisions concerning chronic disease prevention, including cardiovascular disease and mortality reduction. Highlighted in yellow, causing 1 in 3.2 deaths in women each year in the US, cardiovascular disease remains the #1 killer of women, accounting for approximately 1 death every 80 seconds, which means basically for every 3.2 deaths of women in the States, 1 is caused by cardiovascular disease. Some more notes from the Hoddes and Mack study. Menopausal hormone replacement therapy must be considered differently than other medications since no other single primary cardiovascular disease preventative therapy offers diverse systemic-wide benefits. Basically, this sentence means that Hormone replacement therapy is so beneficial that besides cardiovascular disease, it is having benefit with so many other health aspects and preventing chronic diseases. Another note they made that additional benefits beyond reduction of all-cause mortality, including the reduction of menopausal symptoms, potential reductions in cardiovascular disease, cancer and other mortalities, prevention of new onset diabetes mellitus, osteoporosis and bone fracture prevention, improved quality of life, as well as demonstration of cost effectiveness and reduced economic burden, provide further compelling arguments for primary cardiovascular disease prevention with initiation of hormone replacement therapy at the onset of menopause. It is that important, and there's tons of research that endorse this. Menopause is defined as the time that marks the end of our menstrual cycles. It's diagnosed after we've gone 12 months without a menstrual period. Menopause can happen in our 40s or 50s, but the average age is 51 in the United States. That is the definition by the Mayo Clinic. Upon further thought, it is the decline of hormones that drives the cessation of menstrual periods, and therefore cessation of menstrual periods is a symptom of sexual hormone, basically estrogen deficiency. Therefore, the definition should be driven by the cause rather than the symptoms of cessation of periods. Reason I put this slide in because the definition of a condition is very important as it influences the clinical understanding and treatment of that condition. I would redefine menopause as a condition of deficient sex hormones that cause a cessation of one consecutive year of menstrual periods, produces transient motor symptoms, and has long-term clinical implications that may manifest into chronic disease. As we have learned in this presentation, the decrease in sexual hormones significantly increases our risk for many chronic diseases such as cardiovascular, cancer, metabolic disease, type 2 diabetes, among others. Hormone replacement therapy is considered evidence-based practice and responsible medical therapy for women. It is not normal to function without these hormones. 100 years ago and for thousands of years before that, humans typically did not survive past the age of 50, so extremely rare to live without estrogen. Evolution has not kept up with our longer lifespan as we live without estrogen and testosterone for decades, significantly contributing to chronic disease. The end, and thank you for watching. And the following slides are just all the references for this presentation.